Hi everybody, Dr. Spages here again. I'm going to do another quick video. For those of you who don't know who I am, I've been reversing diabetes for years, helping people lessen their need of medication with the help of their doctor, literally seeing them lose weight without exercise, boosting the metabolism, making them feel better, and having a better quality of life. So anyway, I want to talk about one of the key things of understanding diabetes, understanding health, okay? So I'm going to give you an analogy, and hopefully this analogy makes a lot of sense, okay? So let's pretend all of a sudden you're driving down the road, and you're in your car, you're driving down the road, and all of a sudden as you're driving, the oil light goes on in the car, okay? Or some sort of warning light in this car dashboard goes on. So there's essentially three things you could do, all right, when this scenario happens, okay? And it's not yell at your husband or your wife, okay? So that's not one of the examples, all right? But there's three things you could do. The first thing you could do is you could completely ignore it. You just see this light, it's blasting, and you're just saying, you know what, I just gotta get to where I need to go. I can't stop, I have no time to stop, I just gotta get to where I need to go, okay? Now, obviously, if everything turns out good, you get there, but there's a chance, you may not. If it's a long distance and there's really a problem in the car, you may break down. The next option you have is the one that a lot of people do related to health, and I'll explain in a second. But you're driving down the road, the oil light goes on, or some light in the dashboard goes on. So the other option is, it's an annoying light. You want to get rid of this light. This light you do not want to see, you don't want to be bothered, you had all this other stuff to do. So what could you do? So literally you can go to your glove compartment box, right? Go grab black electrical tape and put it over the light. Obviously, that would actually handle the light because you won't see it. It didn't fix anything, but at least you can't see it, okay? The last option you have is, and let's go back to this. You'd break down eventually because you have a problem and you didn't fix it, right? So good. So option one is you go, you see the light, whatever, you just ignore it, you just keep driving, leave the light on. Next option, kind of the same idea, you just cover it up. And the third option is you say, oh my God, there's a light on my car. Let me go figure out what the heck is going on. Let me go to an auto body place or a gas station or something, and let's figure out what's happening. And usually a trained professional who's really trying to figure out what's going on, they're gonna go there, they're gonna open the hood, they're gonna see what's really happening, and they're gonna find why that red light is on. And guess what? Once they fix that red light, the red light goes away. So how does this relate to diabetes and blood pressure and cholesterol and weight and things of that nature? So it's very simple. When you have a red light that comes on, right? And let's use one red light example as diabetes. That's a red light, right? Your body is telling you something is broken, okay? So the next light that pops on is cholesterol levels going high, right? Your body is telling you, hey, something is wrong, right? Your body's not making and utilizing cholesterol the way it should be. Another light goes on with the blood pressure. Another light goes on is your weight. So all of these lights are going on. Unfortunately, the way we're trained in our system is that instead of going there and actually figuring out why the cholesterol levels are high, why your blood pressure is high, why your blood sugar level is high, right? What we've been kind of trained to do, unfortunately, is to go into this glove compartment box and grab black electrical tape. But the black electrical tape isn't black electrical tape, it's a medication, right? So you take your first medication to try to cover up diabetes. It doesn't fix it, it just covers it up. Same thing with cholesterol, same thing with blood pressure. So when I meet a patient who's taking 11 to 20 medications, their whole dashboard of health is literally like, the whole thing is tape. It's all cover up, cover up, cover up, cover up. But the question is anybody really, really, really gone, opened up the hood to figure out why this whole thing is all broken down? And the answer is obviously not. Okay, and that's why I take a completely different approach. I put a link to a webinar that I talk all about this approach. But the approach I take is to figure out what the heck is causing the blood pressure, the cholesterol, the diabetes, all of these things, so the person can actually get solutions to their problem, not just cover it up and cover it up and cover it up with nothing but just electrical tape or drugs everywhere. Okay, so anyway, if you want to learn more about this particular webinar and my approach, check out the webinar. If you want to work with me one-on-one, also there should be a link for that. But anyway, I hope you got something from this. You need a different approach to get to where you want to be in terms of your condition and diabetes and so forth. Okay, so I've been very successful at it. So check out the webinar and hopefully that helps you and gives you some insight on what to do in a whole different approach to get better. All right, thank you for watching and have a great day.